And this is a typical rabbit with spinal problems. We've got lots of signs here that something's going wrong, and it's painful around its back end. So for a start, we can see we've got a bit of a hump here. It's a bit hunched up, and that's because it has got a spinal lesion just about here-ish. We can see it's really unkempt. This rabbit's not turning and grooming very well. And if you look closer, we can see some cecotroph there. And this rabbit isn't taking its cecotrophs properly because the reflex breaking down because it hurts too much to turn around and take the cecotroph off. We do some x-rays and stuff. We can see what sort of things may lead up to this. This is a giant rabbit, so you can probably tell from the size of it for a start, but also we can see why these things happen. So you just look at the valgus on this rabbit, the conformation. So these stifles are under immense stress the whole time. And it's no wonder they get so much stifle arthritis and stuff. We will see some hip problems occasionally. We get newborn bone formation will occur through these. Again, probably better positioning on this hip for a start. If you do position better, sometimes you'll see you do occasionally get degrees of hip dysplasia and stuff where you've got socket malformations, and you can start seeing the reaction around those, looking more like our dogs do with that. And again, if you look at these stifles too, again, you've got this lovely valgus, and you start seeing the bony reactions occurring on the lateral surfaces there. And again, probably just here on the medial surface, where that stifles under a lot of strain. And these are long-term conformational problems that will result in wear and tear and the joints becoming sore. And then we have the situations where we have something absolutely amazing. And this is a typical history, so we'll talk about this in a moment, really. But this rabbit was presented 8-9 years old, weak on the back end. And the owner, excellent owner, knew the rabbit inside out, back to front. Never had an injury, never had anything like that, no medical history, anything like that at all. So this almost certainly happened when it was very young before they had it. And this is a typical young rabbit type of subluxation spinal fracture, usually from picking up wrongly, usually from panicking, kicking out the back when they're handled. And it's just set in the wrong position there. But for about 8-9 years, that rabbit has walked about perfectly normally, behaved perfectly normal, maybe some subtle signs, but overall okay. And it suddenly just gets weak enough as a problem there. It's amazing what they put up with, amazing what you find later on those. And you wonder, how on earth did that rabbit keep moving? And that's a big deal, early handling. And one of the big preventatives for spinal arthritis is getting that handling right. And this is especially important now that the changes in the pet licensing stuff means you can't sell a rabbit before 8 weeks old. Now, rabbits start to socialize when they emerge from their scrape, from their den. They start finding out about stuff. Now, that's way earlier than that. So with the situation you sometimes get where the rabbit's just left with mum, they have to get on with it, and they're only really handled when they're about to be sold or they're being sold. It's a long time after that. It's very difficult to learn. And so, of course, their first handling, well, this is brand new, they're going to panic. And this is when the injuries happen, usually at a very, very young age. So they need to learn how human handling's okay at that very early stage. So about the 2 week stage, about when they were emerging with their eyes are open, that handling's okay. And it's not a scary thing, get used to it too. And so you want to avoid the fact that you don't want the rabbit to be only handled very late, when they're going to be fearful, when they're struggling, and especially if their first real handling experiences are by new owners, when they're inexperienced and not sure what to do. And that's when really the big accidents happen. And it might just be initially just a quick squeak and a bit of pain, and then it's all much better a few hours later. You know, that's all what people may actually see, but the damage is done for later on. And again, you get this type of thing, these absolutely spectacular changes. And it's not surprising these lead to long-term sequelae. We get some more subtle stuff too, again, sort of wear and tear things. We'll probably see a little bit of reaction on this joint. We can see a little bit narrowing on this joint too. And these are, more common type of, if you like, wear and tear on there. Usually around that area too, is an area of the back that takes a lot of strain for these rabbits. And always worth doing two views. And again, if you're looking certainly around these weak back ends, you look at compare the two sides. Here we can see some new bone formation. And this is where we're going to get some nerve entrapment on that L7 sacral exit there too, which may lead on to sort of maybe some bladder issues. We will see some of the pure disc disease, very unusual. We've actually got calcified discs here. Certainly with giant breeds, you can certainly see some disc-related issues. Again, sometimes you'll see narrowing of a particular vertebral space, but disc disease will occur, especially in giants. And again, it was same as dogs, not necessarily related to anything other than maybe some genetic tendencies.